Understanding painkiller addiction begins with recognizing its complexity. It's not merely a physical dependence, but a multifaceted health issue that involves both the body's and the brain's response to pain relief, often leading to a relentless cycle of need and fulfillment. The psychology behind addiction reveals that the brain gets hooked due to the euphoria painkillers can provide. This pleasure becomes something the brain craves, rewiring itself to prioritize drug use over other, healthier rewards, trapping individuals in a cycle of dependence. Genetic predispositions play a significant role in painkiller dependence. Research suggests that some individuals are more prone to addiction due to their genetic makeup, which can influence how their bodies react to drugs and the likelihood of developing addictive behaviors. Environmental factors, including upbringing and social circles, significantly impact addiction. Those raised in homes or communities where drug use is prevalent, or who associate with peers who misuse drugs, are at a higher risk of falling into the trap of addiction themselves. Mental health conditions like depression and anxiety can serve as catalysts for painkiller addiction. Individuals often use these medications as a form of self-medication, attempting to alleviate their mental anguish, not realizing the potential for addiction and the vicious cycle it initiates. Personality traits significantly influence the likelihood of developing an addiction. Risk-takers and thrill-seekers often search for new, intense experiences, finding a dangerous allure in the euphoric effect of painkillers. This pursuit of a novel high can quickly spiral into dependency. Chronic pain not only affects the body but also the mind, creating a fertile ground for addiction to take root. The continuous struggle with pain can lead individuals to rely heavily on painkillers, not just for physical relief but also for psychological escape. The brain's intricate wiring plays a crucial role in the journey to addiction. Painkillers interfere with the normal functioning of neurotransmitters, leading to altered mood states. Over time, the brain begins to crave these changes, reinforcing the cycle of dependence. Stress, a common trigger for many psychological issues, also acts as a catalyst for painkiller addiction. Individuals often turn to medication as a quick fix for stress relief, unwittingly setting the stage for addiction as they become reliant on the temporary solace it provides. When traditional coping mechanisms fail, painkillers can seem like an easy solution. This reliance can swiftly morph into addiction as the body and mind begin to demand the drug to function normally, sidelining healthier coping strategies. The role of prescription practices in facilitating addiction cannot be understated. Overprescription or lack of oversight can lead unsuspecting patients down the path of dependency, highlighting the need for medical professionals to adopt more stringent guidelines and monitoring of painkiller distribution. Understanding tolerance is crucial in recognizing why some individuals escalate to addiction. As the body becomes accustomed to the drug, higher doses are required to achieve the same effect, pushing users into a dangerous cycle of increased usage and dependency. The concept of reward sensitivity sheds light on the psychological underpinnings of addiction. Individuals with heightened sensitivity to the euphoria painkillers provide are more likely to pursue that feeling repeatedly, despite the known risks, driving them deeper into addiction's grip. Social isolation acts as a fertile ground for painkiller addiction to take root. Without the buffer of supportive relationships, individuals may turn to substances as a form of self-medication, exacerbating the cycle of dependency and isolation in a vicious feedback loop. Trauma is a significant psychological factor contributing to painkiller addiction. Those who have experienced traumatic events often seek relief from their pain through medication, inadvertently setting the stage for addiction as they become reliant on the drug's numbing effects. The illusion of control often leads individuals to underestimate the risk of addiction to painkillers. Many believe they can stop any time, not realizing how these substances rewire the brain, making quitting without help more challenging than anticipated. Psychological resilience plays a crucial role in shielding individuals from the clutches of addiction. Those with strong coping mechanisms and a supportive environment are less likely to turn to painkillers as a means of escape from stress or emotional pain. Educating people about the dangers of painkiller addiction and the signs to watch for can significantly reduce the number of people who fall into its trap. Awareness campaigns and health education can empower individuals to make informed decisions about their health. Intervention strategies often focus on psychological approaches such as cognitive behavioral therapy to help addicts understand and overcome the underlying issues driving their addiction. Tailored treatment plans offer a beacon of hope for those trapped in the cycle of addiction. Support systems, including family, friends, and support groups, are invaluable for individuals battling painkiller addiction. A strong network can provide the emotional support and encouragement needed to navigate the difficult journey towards recovery and maintain sobriety. Recovery and rehabilitation mark a pivotal phase in the journey back from painkiller addiction, where individuals embark on a psychological pathway to healing. This period involves not just the cessation of drug use, but also addressing the underlying issues that led to addiction. It's a time for rebuilding trust in oneself and learning healthier coping mechanisms. Preventing relapse is crucial in maintaining long-term sobriety. Psychological techniques and coping strategies such as mindfulness, stress management, and establishing a supportive network play a significant role. These tools empower individuals to recognize triggers and effectively manage them, ensuring a resilient stand against the temptation to revert to old habits.